All right, so let's just do a little restart here. Technical difficulties here on the task force. We're not AV professionals, but we're doing our best. So the new projection is for a continued decline. What does that mean? All right, so what it means is that the number of cases per day is on a long, slow decline that started before Thanksgiving, about 1 week before Thanksgiving. And it's continued up through this week. And so what that means is that COVID is declining in the area. There's fewer people that seem to be catching it right now, or at least that are testing positive. If this continues, we can expect things like the number of people in the hospital with COVID to decrease, and put less strain on our hospital system. But in the end, here's the thing: is the virus is really easy to predict, and humans are really difficult to predict. And the thing that's changing the transmission rate is our behavior as humans. And so if we continue with whatever we've been doing since before Thanksgiving, if that continues, then it will continue to decline. But if we change, and things change and our behavior changes, say we start taking our masks off, the projection will change and COVID will come right back, and we'll have more people with COVID in the hospitals. So that's what it means for right now. We're projecting a decline.
And I agree completely with you, Dr. Berg, but I also want to say that while our community may all be doing the right things, we also have an influx of visitors, tourists that come to our community as well, and sometimes they can bring that virus with them. So we really need to watch that as well. But I appreciate that. So I have a viewer here that asked the question, how much do doctors get paid for a death certificate with COVID-19 listed as the cause of death? So just for the viewers to understand, doctors do not get paid per death certificate. They get paid to treat or take care of a patient. So whatever the cost is for treating that patient, whether it's for heart disease or cerebral vascular accident, that would determine the amount of pay that they would get paid. So the death certificate doesn't have a bearing on that.
All right. Yeah. Thank you for that, Annette. That's a conspiracy theory right now, that there's some sort of bounty. Doctors don't get paid like that. Okay, we've got another question here. Do you know where to get the transmission rate for Nueces County, not the whole coastal bend combined? This is an interesting question. I do know how to calculate that, but the task force hasn't been charged with tracking Nueces County or each county independently. And one of the things is that there hasn't seemed to be a need to track each county in the coastal bend independently of each other, because we are sort of a cohesive unit. And so I would be able to calculate the transmission rate for just Nueces County. We could also calculate the transmission rate for a building that resides within the coastal bend, or households. Like, one thing is that it's for sure the transmission rate in people's houses is super high because nobody's protecting themselves usually inside of a house. But ultimately what we're interested in is the bigger picture and the transmission rate in the greater coastal bend area, because people commonly work in one county and live in another county, and so you can't really divide it up by county for us. That's why we do it for the whole coastal bend. And right now the transmission rate is 0.9 over the whole coastal bend area. So in Nueces, the transmission rate is about 0.9 also. All right. Hi, Jason. Do we have any questions from the audience?
Not so far.
Okay.
So.
All right.
Okay, so we're going to switch over to vaccines now, the topic of vaccines. And I'm going to take the first question that I see here. And it says, are there enough vaccines for all first responders in Corpus Christi? And the answer is clearly no, there are not. Not currently. Now, there will be eventually. And the reason I say that is because when our hospitals received vaccine, We know that our Krista's health system received almost 5,000 doses, and our Corpus Christi Medical Center HCA hospital received almost 1,000 doses. That's not enough to vaccinate all of the healthcare workers, but it is a start to start vaccinating the frontline workers. And these are individuals that are actually at the bedside with COVID-19 patients. They're helping to treat them. And so while it's not enough for all first responders, and when we think of first responders, we think of police and fire included. And so no, it's not quite there yet, but it's a beginning, and that's a great start for all of us. And we were so excited when what we call V-Day, Vaccination Day, came. And so we're continuing to see more. We have more vaccine coming in as we speak. And so it's a very, very exciting thing for us, but we're not quite there to have enough for everybody. When we get to the point where we have enough vaccine for everybody, it's going to be open to the general population at that point. So the next question that I see here, it says, when you conduct a drive-through, how will you monitor for reaction? If somebody has an adverse reaction, will they wait 15 minutes there? What's the plan? And that's exactly right. Yes. So once you get vaccinated through one of our drive-through events, you will go to a parking area after you've been vaccinated where you will wait for the 15 minutes. When you sign up for our drive-through through the Luminaire system, it actually will tell you on your phone when your 15 minutes are up. And once your 15 minutes are up, then you can leave at that time. So yes, we will be monitoring for adverse reactions so we can report them up to the state. I see another question here that's that I can probably answer here, and it says, will the folks getting vaccinated be monitored to make sure the vaccines are doing what's expected, and will that information be shared with the public? So once you're vaccinated, we will not continue to monitor you. So you do have to have 2 doses though. So we will send you an email or a text message basically just telling you that you need to get your 2nd dose. But once you received your 2 doses, we're no longer, we're not monitoring you for anything. If you have some type of adverse reaction later on, a day or 2 later, you definitely can report it. There's a system called the VER system. You can report it directly to CDC, or you could always call us at the Health District 826-7200, and you can report it to us, and we can report it. So I hope that answered your question.
Right, and if you're having a problem with the vaccine, and Jason, we can hear you typing. If you're having a problem with the vaccine, you should definitely have a call to your doctor also to make sure that they're aware of the situation. Okay,
Yes.
Moving on to the next question. After having the vaccine, how long before one can say they have immunity? How long does it last? And we'll take that first. So right now, because the trials have only been going for so long, we know right now that immunity is conferred for at least 3 months, but the total duration of immunity is not known yet. Hopefully it's much longer than that. Let's see. The second follow-up to this question was who should not take the vaccine, and there's some certainties of who shouldn't take the vaccine. For the Pfizer vaccine, nobody under 16 should take the vaccine, and for the Moderna vaccine, which was just approved, nobody under 18 should take that vaccine. Beyond that, if you've had allergies to vaccines in the past, this vaccine is different. You should talk to your doctor, but this vaccine has a different base in it, and you need to talk to your doctor to confirm that you will likely not have an allergic reaction to this COVID vaccine as opposed to other vaccines you've taken in the past. And it's also possible that after your first injection, you determine that you have an allergy to this vaccine, in which case it's recommended that you don't get the second injection. And again, that's a discussion to have with your healthcare professional. Beyond that, other groups, if you have any sort of concern, you should certainly talk to your doctor. But there's no hard and fast boundaries on who else should not get vaccinated. Okay, next question. Will COVID-19 be seasonal like the flu? Okay, we're going to hold off on answering this question. I think that nobody's really sure about this yet, but we're going to watch this and see what happens. with the experts, the epidemiologists, and see if they're able to answer this question. But for right now, we're going to punt on this one and come back to it at a future date for you guys. Let's see.
I think something that I would like to add to that, Dr. Bird, is a lot of people are asking us questions at the health district about what's in the vaccine. And the question they're really wanting to know is there mercury in there? Is there thimerosal? And no, there is not. This vaccine does not have any thimerosal. It does not have mercury in it. It doesn't even have preservatives in it. And so a lot of people are concerned when there's preservatives, what's in the preservatives, because they could have allergic reactions. So it doesn't have those preservatives, and that's why it's really a very unstable vaccine. We have to really treat it very fragilely. So when it arrives, everybody's heard it has to come in and it has to go to the ultra low freezer temperatures, in order for us to keep that integrity in the vaccine. And so just so everybody knows, it does not have thimerosal, it does not have mercury in it, which is a really good thing. So, and the other thing is that the pregnant women were not part of the Pfizer trials. So they were excluded. And I think that's important to know that, because we don't really know if there's, we don't believe that there's going to be any adverse reactions for pregnant women. But like Dr. Bird said, it's always a good idea to talk to your OBGYN about that, because we believe that you could get a very good response. And we do know that pregnant women actually have very adverse complications from the COVID-19 itself. So it's your responsibility to kind of get an understanding of the vaccine and try to determine if the risk outweighs if the benefits outweigh the risk. And so if it's more beneficial to get a COVID-19 vaccine and protect yourself, or do you think you would be okay if you actually got COVID-19? Because pregnant people do not do as well when they do get the virus.
Okay, and I think to wrap this up on the vaccines, it's probably going to be a good idea to talk about what the vaccine does do. The vaccine contains messenger RNA. You get that injected into your body, and your body cells go and transcribe that messenger RNA into the spike protein of the virus. It's completely non-active. It doesn't really hurt you in any way, but it allows your immune system to become familiar with what a bad virus looks like COVID-19. And when you do actually encounter a live COVID-19 virus, after your immune system is wise to it, it can mount a response, and that's what's conferring your immunity. It doesn't interact with your DNA in any way, shape, or form. It doesn't enter your cell's nuclei. It stays, kind of external, and it creates. I heard earlier there was a conspiracy theory that it was like some sort of zombie thing. It creates zombie coronaviruses that your body can easily defeat, and then and it's only parts of it. It's not even the whole thing. It's not active in any way, shape, or form. So the vaccine, it's very well conceived and works very, very well in the trials thus far.
Right. The 95% efficacy. So there is 5% that they actually could get COVID-19, but even if they did get COVID-19, they're saying that they would get a very minimal with very mild symptoms, and they would not end up in the hospital if they were vaccinated. So those are all really good news and good reasons to think about getting your COVID-19 vaccine. All
right. Thank you. So, Jason, do we have any questions from the audience?
No, no more questions. So thank you both for taking the time out of your busy days to answer questions for us. I apologize to the public. Had some technical difficulties, but thank you for bearing with us. We'll continue to work on that as going forward. I would not anticipate one of these Q&As next Friday, but please continue to post your questions to Facebook, and we'll answer them as quickly as we can. Thank you. Have a safe and festive holiday.
All right, and we will be doing the question and answer on Thursday, right?
Thursday, okay.
I believe that's what we agreed upon. So next Thursday at noon, Christmas Eve, we'll do another Q&A, and the task force will be releasing a new report on Monday afternoon And you'll be able to find that on our social media pages or the other places that you might find it, like cctexas.com. So you can go to Facebook or Twitter or Instagram at CBCovid, or check out CC Texas, or I don't know, any of the other ways that those videos get distributed, and you'll be able to get your weekly update. All right, thank you everybody for tuning in, and we'll see you on Monday.
Thank you.